Welcome to our immersive VR experience. Today we're diving into a critical medical procedure, inserting a chest tube. This VR tutorial will give you a unique, hands-on perspective from the point of view of the person actually performing the procedure. Dr. Brian Buchanan will guide you through each step of the chest tube insertion process from preparation to completion, ensuring you understand the key techniques and important safety measures. Remember, practice makes perfect, and VR experience is designed to help you master the art of chest tube insertion. Ready? Let's go.
Okay, so first we're going to landmark the area, okay, and to landmark the area we image first with we're going to use a curvilinear probe, okay, it's got a really nice depth, okay, and will offer us pretty good resolution in the lower thorax. So we're going to apply the curvilinear probe first to landmark our area to make sure it's the appropriate entry site for thoracentesis or a subsequent chest tube. Okay, so let's apply the curvilinear probe. Okay, we're going to apply with a marker towards the head. We are in the conventional radiological position on ultrasound with the screen marker right. And here we can see that there is the diaphragm, the lung, and again, screen marker right, depth we're 16 centimeters. So this looks like a favorable entry site, okay, nice big anechoic space. But let's move the probe now 90 degrees, marker towards the ceiling, okay. Yeah, marker towards ceiling, that's good. And let's just make sure that on both axes we have enough space. Let's go a little more superior. There we go, that's a nice anechoic space, okay, so we have a good distance there, at least 4 centimeters for needle entry, that's very safe. Let's mark this area with the blunt fill cannula, okay, again, just the blunt end, and we're going to mark there in advance, okay, this is more of a static guidance technique where we mark in advance, then we're going to prep and drape the area, okay. So once we're happy with this, we're not going to change positions, okay. The next thing after this probe's applied and we're satisfied with the position is we're going to apply the actual linear probe to make sure there's no vessels in the area. So let's swap out probes. And we're going to look for blood vessels. So we're going to apply the probe with the probe marker towards the head, okay, and we're going to look across the vascular space and look for any obvious blood vessels in this area, okay. Generally in this area, the neurovascular bundle, okay, the arteries and veins in the intercostal space, will be below the rib. So we aim above the rib to prevent inadvertent puncture. Okay, so thinking about if the marker is towards the head, okay, then it's going to be under. So there could be some space there. We can put some color on that space. Okay, and we can look for any obvious vessels that are in the middle of the screen. Okay, so generally the vessels will be right below the rib. Okay, this is color. We can even put on some color power Doppler there. We can see the vessel, okay, under the superior aspect of the rib. Okay, so we want to aim at the overlying rib and go over the rib to avoid penetrating the neurovascular bundle. So now that we're happy with the space, okay, we're going to go ahead and we're going to prep the skin and drape the patient and then start with the procedure from there. And we'll introduce all the instruments. Okay. Okay, so you have now prepped and draped the patient. So this is how we prepare and drape in the intensive care unit. If you're in a clinic, you might drape differently, maybe with a limited, either green towels or a paper drape, for example. But here we're taking kind of full sterile precautions. So the area has been prepared with a chlorhexidine solution. We've draped the area now. The next step from here, step 1, is to basically, we've landmarked the area beforehand with static guidance. Let's freeze the periosteum of the rib, or the skin, and then the periosteum, and get down to the pleural space and make sure we're happy with our trajectory. Okay, you may now proceed. Excellent, so we'll make a little bleb in the skin and just freeze. Perfect. So at this point, you can change to a longer needle, okay, so a longer needle to get down to the rib periosteum and to the pleural space. So we will switch to a longer needle, and normally it's also a bigger gauge as well, so this is probably a 22 gauge. Now we'll aim directly for the rib. Okay, so we aim for the periosteum. We freeze the periosteum. And then we pass just slightly over the rib. Okay, and let's see if we can find a nice trajectory. Can you pass it all the way to the pleural space? Yes, yeah. So if you hit the rib, just go over. Hit the rib, go over, and just keep aspirating with your other hand to make sure you are satisfied with your approach. Because that is the key here. Okay, aspirate continuously as well. Okay, keep going. There we go. Okay, keep going. Yeah, you got some fluid back. That's nice, nice and clear actually. So that's your trajectory that you'll follow with your bigger needle. Okay, so from here the needle will come out and you'll put some gauze over the area. So that's a nice trajectory. Okay, so we are going to do a pigtail catheter. So we've already prepared and draped the patient. Okay, this is a Firmin 8.5 French pigtail. So we've already landmarked the area with static guidance, and we've already frozen the area. And that's, we've frozen the periosteum, and we've frozen down to a nice track in the pleural space. So we have our kit here. We have our finder needle. Okay, that's with the pink hub. Okay, we have our wire, which we can see here, a J-hook wire. Then in the gray there, we have our dilator. Okay, that's our dilator. Then we have our pigtail, which has no string on it and unfurls over the rear end of the wire. And then we have our device, which is lure locked to Christmas tree, which attaches to a chest tube assembly. Okay, one moment here. I'm going to actually turn the lights out a tiny bit. Okay, so let's make sure our site is good. Again, we've already landmarked to make sure, but now we're just going to double check and make sure that the site is appropriate. Okay, it looks like you have a nice large anechoic space. Lots of room there, lots of space. So we are going to, again, we've chosen this site. So let's go ahead and put in the finer needle. Again, aiming for the rib first and then over the rib into the pleural space. And actually, I'm going to put lights on here, one sec. Okay, so again, aim for the rib directly and then just walk over the rib, making sure you are perpendicular to the chest wall. And we're passing through our small incision here. It's looking good, it's coming. Slowly here. Yeah, keep aspirating. We'll get a nice sample here of pleural fluid.
Am I getting that?
Yeah, you're getting some. I can see it there. There you go. I think it's coming now. Okay, so from here you will detach the syringe. Okay, now we're going to cover that the needle over, or cover the end of the, so we don't entrain air for now. Okay, and then we're going to pass that needle. Sorry, pass the wire. Yeah, you can use that straightener. Yeah, exactly. Yeah. So let's pass the wire here. Once we get to like 15 centimeters ish, it's probably okay. So we can take the plastic wire holder off. Yeah, just make sure you don't lose the track of the end of the wire. That's perfect. Okay, so from here the needle and this can come out. Okay, we'll leave the wire in place. This is Seldinger technique. Now we're going to ultrasound the wire to make sure it's in good position. So let's get the curvilinear probe again and make sure we're happy with the wire position. This is just especially if you're uncertain of the location. Okay, so we'll just move the probe here. Yeah, there's the wire there. Okay, we can see it pass down. Okay, again, if you're happy and you've asked for the pleural fluid, this step may be unnecessary, especially if you have a nice, good location, but it doesn't hurt. So the next thing is to pass the dilator, being extra sure that we are perpendicular to the chest wall, okay, or to the ribs themselves, just so we don't bend or kink the dilator. This will require some sustained pressure at the site with both hands. Yeah, make sure it passes nicely. Doesn't have to go all the way, but just enough to make sure there's a tract from the pleural space to the outside. Perfect. Now that's there, that can come out. Okay, if we're happy with that, we can now unfurl the pigtail over the rear end of the wire. Just being sure here that the wire is not a very long wire, so let's not make sure we leave too much of it outside the chest wall. So there we go, just threading the wire. So this will pass directly over the wire, and being sure not to pull the wire as we pass it. Okay, so pass it, only leave about an inch out, so he can keep going with the tube. Excellent. Okay, perfect. Okay, let's remove the wire. Okay, and at this point, we can get a sample. So let's actually, I think we're okay here. If you want to actually maybe get a bigger sample, yeah, with that one. Okay, we can be happy here that we're in the pleural space. If we want to send this for a quick analysis of lights and also microbiology, perfect, nice serous fluid. Okay, so this is obviously not a sanguineous effusion, but we'll send it for sample. So from here, this either could be thoracentesis, so you could take the tube out after you get a sample or drain it, or you can leave it in. In this case, we're going to leave it in as an indwelling chest tube. So we're going to suture it in with the suture first to the skin, and then once it's sutured to the skin, then we're going to attach the tube to a plurivac. So now that we have a sample, what we're going to do is use the stopcock. We're going to swap it out for the three-way stopcock. And let's just undo the syringe there, put the stopcock on. Now that it's on, we're going to turn the little lever towards the patient. Okay, that means it's off towards the patient. Correct. Turn forward. Yeah, this gives us time. Now it's isolated. It's not going to entrain air. Now we can suture in the device. Okay, so let's suture in the tube now. Yeah, we have some Kellys there, or some needle drivers there too.
Because it'll be around this?
So suture to the skin first. Okay. So throw a loop to the skin first and then around the tube.
Okay.
Yeah, I'll show you.
Okay. So I would just first make an incision here? Or
just on one side of the tube, just pass it through the skin. So we're going to pass through the skin just maybe a quarter of an inch away from the tube. Yeah, just right there, pass it right through. Okay, being sure not to poke yourself here, of course. This is a bit of a bigger needle, so you might, it might take a little bit extra. Yeah, okay. Now what we're going to do here, this part is, once you pull through the needle, go ahead, keep pulling it through, yeah. Okay, we're going to make the tails even. Okay, yeah. We can actually cut off the needle now, so we don't need the needle anymore. So we can cut it off. It just makes less likely to stick yourself. Perfect. Okay, so we've cut off the needle. At this point in time, we're going to throw down a couple knots just to the skin.
Okay, great.
Yeah.
I'm really bad with the hand knotting.
That's fine. That's fine. Yeah, go ahead. Yeah, it's all good.
Okay.
But if you ever want to talk about hand knots, I can show you how.
Okay. So just regular knots?
Yeah.
Okay. Wait, how do I usually do it? Hold on. I'm in pressure. Okay. Like this regular knot
That's
work?
fine. Yeah,
Okay.
that's fine. Yeah,
Okay.
yeah. No, it doesn't need to be anything fancy, to be honest.
Okay, hold on.
Hand ties are actually strikingly the same. It just, they look more complicated than they truly are.
Okay.
But like I said, if you want to learn how to do hand ties, I can help.
I would love
Throw on a couple. Great. Okay. Now we're going to tie. So now that we suture to the skin, now we're going to suture to the chest tube itself. So let's suture that to the tube. So what I'd recommend is, you know what a Roman sandal is?
Mm-hmm.
So around the tube with both. And come around the tube again. Other side. Go around again. Okay. And tie one knot. Okay, so if you can tie a knot there.
How do you usually hand tie?
You can just tie a regular knot. Yeah, that's fine. And so one cinch, what'll happen is not too hard. Okay. Now push it all down to the bottom near the skin. Okay. Good. Now pull it tight again. Okay. Now you want tight enough so it very, very slightly indents the tube. Okay, but not enough to occlude it. Does that make sense?
Okay.
Yeah, like that. It's perfect. Okay, now throw a second knot down.
Okay.
Just regular knot, yeah.
I forgot how to do it.
You're so close.
Hold on.
Great. Awesome. Okay, we'll throw down a few more knots here and make sure it's super secure, and then we're pretty much ready to attach to the thoracic drainage device. Excellent. Okay. So yes, now we'll connect to the plurivac, and then we are done. We'll get a chest x-ray. Again, we only drain about 1.5 liters at max at a time, and then we wait 6 to 8 hours after before unclamping again. Okay. So actually the next step we're going to do here is once I bring the plurivac, we're going to disconnect the stopcock and attach the lure-locked Christmas tree. That's the white to blue device. Okay. So here you are going to take off the stopcock, attach the adapter. Okay, so attach that one. Yep. That's a lure lock device. Okay. Now you're going to take the tube and put it right over the Christmas tree adapter. That's what I call it. I don't actually know the official name, but there you go. You are connected. Okay. So here we're going to put on a bit of suction just to -20 just to help drainage. We can cut off these tails of the suture material as well, just so it's less. Now we will just drape, we'll actually put some bandages over the patient to make sure this area stays clean. Okay, and that's it.